is Brooke. I'll be your student nurse. Can I get consent to do a video recording of a respiratory and cardiac assessment? Okay. All right. What brings you in today?
I started to have chest pain a couple of days ago while watching TV.
Okay. First, I would ask for the patient's name and date of birth, so I'm going to go ahead and do that now. Can you tell me your name and date of birth, please?
Adeline Gentry.
Okay, your date of birth?
March 7th, 1944.
Okay, and your allergies?
I'm allergic to morphine.
Okay, and what kind of symptoms do you present with this morphine allergy?
It makes me really itchy and I get hives.
Okay, all right. And so your reason for coming in today, you said you have some chest pain. Okay, can you tell me a little bit more about that pain? Is it, what kind of pain is it?
It's
Like a sharp pain, a dull pain? A sharp pain? Okay. Does it radiate anywhere else into your body?
yeah.
And when did you first start experiencing this pain?
A couple of days ago.
A couple of days ago? Okay. On a scale of 0 to 10, 10 being the highest, 0 being the least, how would you rate your pain?
It's like 10 out of 10 right now.
A 10 out of 10?
It
Okay.
feels like my heart's almost like beating out of my chest.
Feels like your heart's beating out of your chest? Okay. Does anything make the pain worse or better?
Not really. I've been really nauseous and lightheaded.
Okay. So experiencing some nausea and lightheaded. Have you taken any medication for your pain? Okay. Other than this pain you're experiencing now, do you have any history of chest pain or tightness? Any shortness of breath? No? Okay. Any fatigue or lightheadedness?
Not until recently.
Not until recently. Okay. Any swelling in the legs or feet?
No.
No? Any history of smoking? Family history?
No.
No? Okay. Are you current on your vaccinations?
Yeah.
Yeah? Okay. And do you have any history of any cardiac or lung disease?
No.
No? Okay. Do you know where you're at today?
Yes, the hospital.
Okay. Do you know what year it is?
2022.
Okay. So patient is awake, alert, and oriented times 4 to person, place, time, and subject, and her behavior is appropriate for the circumstances. Her clothing is appropriate for the weather outside. Her physical appearance, she is obviously in pain but calm. She's cooperative. Her behavior is good. And okay. I'm gonna go ahead and start my assessment on you. Is it okay if I get you to sit to the side of the bed? Okay. First, we're gonna examine the posterior chest. Come behind you. The chest is equal. Skin is appropriate for ethnicity. The chest wall or thoracic cage seems to be symmetrical. I'm going to start my palpations now. So whenever you feel my hand, if you can say 99, and if you feel any pain or tenderness, please let me know, okay? Okay?
99. 99. 99.
Okay. Vibrations are present and equal on both sides. I'm going to go ahead and auscultate now. You should listen for 18 breath sounds, but for the purpose of this video, I'm only going to listen to 12. Okay? Each time I place my stethoscope, if you'll just take a deep breath in and out, okay? Go ahead. Okay, breath sounds are present and normal and equal on both sides. Okay, I'm going to come around and I'm going to inspect, palpate, and auscultate the anterior chest wall. Patient's skin tone, again, is appropriate for ethnicity. Chest wall seems symmetrical, equal bilateral. I'm going to go ahead and place my hands underneath your xiphoid process and get you to take a deep breath. Okay, chest wall moves symmetrically. While I'm here, I'm also going to go back to the posterior and assess that one. Okay, it's going to go right up to T18. Take a big deep breath. Okay, chest wall moves equal bilaterally. It's appropriate. Sorry about that. All right, now I'm going to do the 99 test again. If you feel any pain or tenderness, please let me know. And each time you feel my hand, just say 99, okay?
99, 99, 99, 99, 99, 99, 99.
Okay, vibrations were present, so, and they were equal bilateral on the anterior chest. Now I'm going to auscultate. I'm going to listen in 10 places. Deep breath, in and out. Okay, breath sounds were present on each side. I'm going to now get you to lay back, and I'm going to inspect your neck and your jugular vein. So go back this way. The patient's neck looks symmetric, looks appropriate. Her skin looks appropriate for ethnicity. Her trachea is midline. So that looks good. I'm going to lay the patient back flat. I'm gonna lay her back flat. Okay, and for a brief moment, I'm going to take this pillow from you, okay? And I'm going to get you to turn and look that way, all right? Okay. There is no jugular vein distension and no palpitations, or pulsation, sorry. All right, all good there. I'm going to raise you back up. Good for you? Okay. You want your pillow back? Okay. There you go.
Thank you.
All right. I am going to lower this down so I can listen to her heart. Okay. All right. I'm going to listen to your heart sounds now, okay? Just breathe normally. Assess your radial pulse at the same time, okay? Usually you would assess for a whole minute, but for the purposes of this video, I'm not going to. S1 and S2 sounds are present, and the rhythm is regular. Now I'm going to use the bell of my stethoscope and listen for murmurs. So I'm going to assess you in the same way. evidence of murmurs. I am now going to go back to the neck, and I'm going to assess the carotid artery, and then I'm going to listen for any bruits, okay? So I'm going to start by assessing each side, not at the same time. So pulses are 2+ and equal bilateral. Now I'm going to get you to take a big deep breath in and hold it, and then we'll let it out, okay? Okay, take a breath, and we're going to do the same thing on this side, okay? Okay, no bruits, breath sounds were normal. All right, okay, so that concludes that part. Now we're gonna move into the peripheral, and I'm gonna assess your skin for any edema, pulses, and stuff of that sort, okay? All right, so I'm gonna start by assessing the skin. Sorry, let me pull this up real fast. Okay. Patient's skin is warm. It's appropriate for ethnicity. No redness, no edema. Looks good. I'm going to assess the radial pulses. I'm going to move this armband right down so I can assess your radial pulse. Good pulses. +2. They're equal bilateral. I'm going to test your capillary refill. So I'm going to push down. Okay, capillary refill is less than 3 on that one. And less than 3 again. Good. Now I'm going to move into the lower extremities. Is it okay if I assess your legs? Okay. Patient's skin is warm. There is no redness. There's no edema. Her skin color is appropriate for ethnicity. I'm going to assess your pulses. We're going to start with the tibial pulse. Okay. +2, bilaterally equal, and then we're going to do these. I called those by the wrong name. And those are +2, equal bilateral. Patient has nail polish on, so we would usually do the nail bed, but instead we're going to do the top of the toe. We're going to do those at the same time. I'm going to touch your toes. Okay, capillary refill is less than 3. Good. Okay. All right. I do believe that concludes my assessment. Is there anything I can get for you at the moment?
No, I think I'm okay.
Okay. Are you in a comfortable position?
Yes.
Yes? Okay. Here is the call light if you need anything. I appreciate you working with me today and your cooperation through my assessment. If there is anything else I can do for you, you just let me know, okay? Thank you. Oh, and lastly, both of these side rails are up, and the patient I'm going to move into the lowest position. Oh, sorry. Into the lowest position. Our bed is not working, but we would put it all the way down, and the wheels are locked, bed is locked, you're comfortable. We would go all the way down, but it's not working, so. Okay, thank you so much.
Thank you.